Hi, I am CJ Devgan, and welcome to another edition of Breaking Barriers, where my goal is to provide you with proven tools to help you transform your business. We are living in times where business, as usual, is not sustainable. Because new disruptors are arriving every day, therefore, you too must reinvent and break barriers that are holding you back. If you are struggling to grow your business, check out my website at cjdevgan.com and learn about my consulting and coaching services, and let's talk.
Welcome to episode number 4. The focus for today's episode is on importance of digitization of healthcare. So what do we mean by digitization of health or digital health? And more importantly, why is it so critical? We all have been to a doctor's office. Can you relive that experience in your mind? You wait in a waiting room, then you go to the examination room. Once the doctor comes, you explain the reason for your visit. Doctor may ask a few probing questions, and at the end of examination, he or she either gives you a prescription or a requisition for test, such as blood work, X-ray, scan, etc. I understand there may be slight variance in your experience depending on the country and time era, but the major workflow is pretty standard. Now let's discuss these variances. Some of you may know that I grew up in India in 70s and 80s. During those days, most primary care doctors did not have a receptionist or a chart for their patients. What does that mean? Every time I visited a doctor, he did not have a formal historical data on me to make decision regarding my health. He may have good memory and recall what was the diagnosis during my previous visits, but I doubt it. So every visit would start with a clean slate, something like 50 First Dates, an Adam Sandler and Drew Barrymore movie from early 2000s. I don't know if you have seen the movie, but the main plot is that Adam's character falls for Drew's character, who has amnesia and forgets him every morning. So he has to win her over every day. It may be fun in the movie, but in real life, it is no pleasure. Now, when I moved to Canada, the experience was slightly better. Physicians maintain a paper chart. So when I visited, the receptionist will pull out my chart and put it outside the doctor's examination room. So when the doctor walks in, he will read my chart and won't start fresh. He has the history and information from my previous visits. For example, what was my previous diagnosis, results from my previous test, any allergies, other meds I'm taking, etc. And after my current visit, he will document his notes in the chart for future references. Now, even in this scenario, there are challenges. Number one challenge was that data was localized to that physician office because each provider maintained their own chart, which meant historical information was limited to encounters that I had at that physician's office. Now, in some instances, it got shared, provided my other doctor requested the data way in advance. But even then, it was a tedious and time consuming effort because someone has to make um, an effort to find a chart, then either fax or copy and mail it. And in instances where my encounter with that provider is unplanned, i.e., urgent care, those physicians literally worked blind and made decisions without critical data on me. And finally, if and as when patients get older, you can imagine the thickness of the chart. And as the chart grows, it is really difficult for doctor to find data that may be relevant to that particular episode of care. So with the advancement of technology, applications were built for healthcare providers also, which is called healthcare informatics. However, there are multiple challenges with this thing because every provider wanted uniqueness for their product, so that uniformity was missing. Data was still localized, even though it eliminated option number 3, which is you can quickly go through the chart, but the chart is still very localized to that provider. It is not widely shared with other providers. And these provider systems were called EMR, electronic medical record systems. And the goal was to improve quality of care by providing physicians with most relevant information by parsing the historical data on patient. But like I said, the data was still very localized to that physician. Now, the next step in the evolution of digital health is the growth of health information exchanges, which basically acts as brokers to exchange data between different providers' EMR systems. Now, there are hybrid models of these health information exchanges. Some are hub and spoke, which means all the data would be collected, synthesized, and stored at that health exchange system, and then providers can pull data as and when they need. And in some instances, they will just route and translate data, but will not store data in their own internal databases. But in most cases, they were where they would have some basic information on that patient stored. So these types of exchanges, we started to call them as electronic health record systems because they had a single longitudinal record. But again, regulations are different. Not all the information gets shared. In most instances, it is only the ADT, which is admitting discharge data that gets transmitted from providers, but actual clinical data still stays within EMR. So the only thing that providers know that CJ Devgan has had an encounter with a different provider. Now it is their responsibility to reach out to that provider and ask for that information. Still a lot of work needs to be done in this space. Now, the biggest challenge is that why these clinical data are not getting shared. I think we need to get in on another episode, and we will talk more with industry practitioners on what are the different things that organizations are doing to help incentivized providers to share clinical data on patient with other providers.
That is it for today. Thank you for listening. Let's go out and break barriers and generate new possibilities. Please be sure to visit our website at cjdevgan.com. And if you like our show, please subscribe, leave a rating, and a review for us on iTunes.